we have not been successful at treating cancers. Simply because the presentation as cancer is usually very, very slow and almost unclear to whoever is suffering from the disease. In other words, you don't feel this way and know it's cancer. So you may be going to your doctor regularly, but he fails to diagnose cancer in you.
And that is because of microplastics?
In females, one of these cancers that can be treated with a high percentage of cure is endometrial cancer. Why? Because it presents early, abnormal uterine bleeding. Now, a patient in a menopause, for example, postmenopausal, presents with abnormal uterine bleeding. The first thing we have to try to do is assess the endometrium. After we take a history, of course, assess the endometrium. We do that with an ultrasound scan. If the thickness of the endometrium is more than 3 millimeters, then we need to do a biopsy. Get some tissue to find out what is the underlying problem.
When people hear about feeding cancer, what do they misunderstand?
So that the cancer has a way of protecting itself. It's looking after itself, so to speak. So in addition to drawing 200 times the amount of glucose that a normal cell does, it also develops its own blood supply, vascularization. So anything that gets the blood, the cancer will get its fair share. Another thing is, whereas you might say, well, hey, if we keep the cancer short, if we start it from oxygen, then the cancer will die. That's not true. The cancer can live both in an oxygenated environment as well as a deoxygenated environment.
Chemotherapy. In your understanding, your experience, what is actually chemotherapy? Because I'm sure I came across something that chemotherapy is carcinogen.
It can be a carcinogen.
Most people don't realize that some of the food they eat every single day may be quietly increasing their risk. Not because they are unhealthy, but because no one ever warned them. As a doctor, today's guest has seen the same pattern repeat again and again. People shocked to learn that what they thought was normal may have been working against them. This conversation isn't about fear, it's about awareness and what you can do differently. Statistics shows that 1 in 2 people will develop cancer in their lifetime. In 2022 alone, over 20 million new cases were recorded worldwide, and that number is expected to rise sharply by 2050. What's even more surprising is that research suggests up to 40% of cancer may be preventable. So the question becomes, what are we doing every day unknowingly that could be increasing our risk? Today, I'm joined by Dr. Phill Harris, a medical doctor and an author who has spent years studying the relationship between food, fasting, metabolism, and cancer. This episode is about a pattern doctors see and what most people only realize when it's too late. The birth of this podcast is deeply personal. I've poured out countless hours into finding the right guests, shaping each conversation, and crafting every episode with intention. My drive comes from a live experience, from pain, resilience, and a desire to make a difference. By subscribing, you're not just supporting a podcast, you're helping grow a community built on healing, honesty, and real impact. Thank you for being here. Now, let's get into the episode. Thank you.
Okay. Let's just bow our heads and close our eyes. Heavenly Father, as we gather here this evening, we invite you into our midst. We ask that whatever discussion that takes place here may be a word of encouragement and drive thoughts in your direction. Bless us as we go through this exercise and help that may be quite reassuring and rewarding to all. Lead us and guide us is my prayer. In Jesus' name, amen.
Amen. As a doctor, what pattern do you see repeatedly when it comes to lifestyle and cancer?
There are a number of factors in one's lifestyle that can predispose them or push them in the direction which would lead to an increased incidence of cancer, right? One of the commonest ones we know about is cigarette smoke. But dust, dust that arises when we see an above clean zones and so on. Dust from the exhaust fumes from cars. We see dust when work is being done on the road and stuff like that. All those are preconditions or factors that can lead to the development in cancer down the line. Also, what you eat, your foods, alcohol is associated, even water, believe it or not, is associated with cancer.
It's interesting that you say water, but we're going to get to that in a minute. I want my viewers to know who we are talking to. Give us a little bit about your background.
Okay, my name is Dr. Harris.
Right.
Philip. I have been in the medical field for over 32 years. Yeah, over 33 years, really. But my career actually started as a high school teacher, where I taught physics, chemistry, biology. Okay? And then after I started as a high school teacher, I then left and went on to university, where I signed up initially. My first university major was pre-med, because when I left the Caribbean, I'm actually from Dominica. So when I left Dominica and I went to the States, the intention was to become a medical doctor. So when I went, I didn't have as much exposure. So of course, I heard about it pre-med. So naturally, I thought it was a precondition or a step prior to getting to medical school. So instantly I signed up, and then after about after my first trimester, I had an organic chemistry teacher who well, he didn't know much about my background, but I was giving somebody a joke the other day about what he did. One day in a class, he wrote up a problem on the board, and his name was Henry. My name is Harris. So we both have H's as our initials. So he wrote up this problem on the board and walking around the board. He's a short fella just like me. So walking around the classroom, he actually shouting, bossy like. So he said, he asked us to do the problem. So I did the problem, and I sat down there waiting for the rest of the class to catch on. Whilst waiting, he came to me, very upset. What's happened? You don't want to do the question? I said, I'm finished. He said, what, you finished? I said, yes, I'm finished. So he looked at my results, and he put his head in the sky, and he walked around. And then after about 15 minutes, he turned to the class and said to the class, you see, my initials are H, just like Harris's own. Oh. So that talks some volumes,
Yeah.
So after that class, he invited me to his office. So when I went to his office, he said to me, he asked me, well, what was my major? I told him pre-med. He told me, you could never get a job as a nobody's going to employ you with a pre-med major. The only thing you can get to do is teach. Now, I was just from teaching, so I don't want to come to university to continue the same thing I've been doing. Right. So I said, I told him, well, the truth is, I really want to do medicine. And I thought that was a natural stepping stone to get him into medicine. He said, no, that is just a natural science course. So I said, okay. So I said to him, well, what would you suggest? He said to me, well, if you change your major to chemistry, then I could give you a job in my lab. Now, there was an important lesson to be learned here for me, because in my first trimester, I paid $40 per credit hour. If I was to change my major to do chemistry and he was to give me a job, that fee would drop from $40 per credit hour to $4 per credit hour. So it made sense for me to do that. So I changed, I got to the job, and I started working in his lab. Eventually though, I got in, and the rest is history.
Well, just want to say thank you for playing an important part in the life of health for many people around the world. I'm sure you have a lot of customers, patients rather, that visit your institution, and we value your work.
Thank you.
Thank you also for taking part in this podcast. Cancer is one of the reasons why I started this podcast.
Okay.
And since I started doing my research about cancer in 2023, what I've noticed, cancer in the 80s was a very small margin comparing to now. And it is expected that cancer will rise triple times the last marker, which was in 2022. Why cancer are still on the rise despite advance medicines?
Well, the thing is, we have not been successful at treating cancers simply because the presentation as cancer is usually very, very slow and almost unclear to whoever is suffering from the disease. In other words, you don't feel this way and know it's cancer. So you may be going to your doctor regularly, but he fails to diagnose cancer in you. Right? For example, one of the commonest features we see is people complaining of IBS, ladies over 50, for example, presenting for the first time with IBS symptoms. That should trigger in the minds of the doctor to assess her ovaries. Right? But then IBS, okay, so we'll give you some medication for that, and that's it. So you see, we have missed an opportunity because the best way to cure cancer is by picking it up early. The earlier we pick up cancer is the better a chance we have for curing the disease.
For people that do not understand IBS, what is IBS?
Irritable bowel syndrome.
Yeah.
It's like spasmodic bowel pains.
Okay.
Yeah, and we use a number of antispasmodics for that and so on, but that may be the manifestation of something a little more sinister.
Okay.
Like I said, you need to look at the lady's ovaries, And if you see anything suspicious there, you conduct further investigations like blood tests and so on, and then decide how you proceed.
You said that the best thing to curing cancer is to find it early.
Early, yeah.
Why is that?
Because you have more options. For example, currently, for cancer treatment, we have pharmacotherapy, where you give them drugs, chemotherapy, you have radiation, where you treat localized foci of cancer, or you have surgery. Those are the three parameters we use: surgery, radiation, pharmacotherapy. Now, surgery is for localized lesion. So if you have a lesion on your foot, for example, and it hasn't spread, it's found early enough, you could just excise it, and you may effect a cure by doing that.
Right.
If it has gone beyond the local area and it has just spread within the vicinity, if it's radiosensitive, you can treat that cancer with radiotherapy. But if it has gone beyond the area, if it has spread all over your body, chemotherapy is the only option we have.
So it's not all cancer radiotherapy use on?
No, radiosensitive cancers, there are cancers which are more sensitive to radiotherapy than others. Okay. So,
what do people do daily that they believe is harmless but see linked to cancer risk again and again?
Drinking water in plastic bottles.
Drinking water in
plastic bottles, yeah.
So like this?
Yeah.
Oh, mercy.
And heating up the foods in plastic containers.
Why is that?
There is an entity we call microplastics,
right,
which are released into your foods.
Right.
All right. Now, much is not known about microplastic at this stage, but information on microplastic is spreading. Right. One of the factors you'll find is that with microplastic, there's an increased incidence of Alzheimer's disease.
Right. I've seen that research.
There's an increased incidence of bowel cancer. And there's an increased incidence of bladder cancer.
And that is because of microplastic?
Microplastic and chlorine in the water. Yeah, if I just talk to you a little bit about chlorine, you see, we were told that chlorine is added to water to sanitize the water.
Right.
To sterilize the water. But chlorine is a potent oxidizing agent. Right? It's one of the top agents in the electrochemical, that's electrochemistry. What it basically means, the higher element is in the electrochemical series, is the greater the potential for it to oxidize anything below it. Okay. Now, if chlorine is a potent oxidizing agent, when you drink water, where does it stay? It comes through the stomach. It may pause there for a little while. After it is passed through the system, you pass it out into urine. Yeah. The urine, so the water stays in the bladder for a little while. The two foci for cancer commonly seen in chlorinated water is the stomach and the bladder. So that should tell you something. So the oxidizing potential of the chlorine continues even in the stomach, in the bladder, creating an environment which encourages the development of cancer.
So colon cancer, that could contribute to colon cancer as well?
Well, of course, because the water, if we're looking at, it's not the only thing, but one of the contributing factors.
You know, one of the interesting thing about what you just said, and you probably can, back me on it. So I had a car wash in Jamaica, and I remember there was a time when the pipe, we used to have a tank where we run the water through, and there was a time where the tank was blocked. We couldn't think of what could block the pipe, so we had to drain the water out. But one of the most interesting things that I've seen at the bottom of that tank was built up chlorine, and that blacked up the pipe. And I'm thinking, what if this is how it reacts inside of our bodies?
Chances are it does.
Blacked up our organs? I don't know.
Well, it may not do it may not necessarily do it directly, like chlorine enters your organs, so as such it blocks it up. It doesn't not necessarily directly. But what chlorine does, you remember I said chlorine is one of the most potent oxidizing agents.
Right.
We have been told about LDL and cholesterol in the past. Right? LDL is a bad cholesterol, HDL is a good cholesterol. HDL, high density lipoprotein, or LDL, low density lipoprotein. That is an oversimplification. LDL is not necessarily a bad cholesterol because your body needs LDL. In fact, 70% of your LDL is produced in your body. So the obvious question is, why is your body producing substances that will kill it?
They said it helps the brain as well, right? LDL.
It is very useful for production of certain hormones. It's it protects the intima, or the lining of the blood vessels, and it's helpful in terms of correcting any injury, blood vessel injury. It's needed for those kind of things.
So how do we differentiate the good cholesterol from the bad one?
All right. No, I'm going to tell you this. So like I said earlier, LDL is not necessarily bad cholesterol because the body is making it. So why the body would not make something to kill it? It doesn't make sense. All right. The bad form of the cholesterol that they have not been telling us about is the oxidized form, oxidized LDL. Remember I told you chlorine is an oxidizing agent. So chlorine, in conjunction with the microplastics, helps to push LDL into the oxidized form. The significance of that is the oxidized LDL is smaller, but it's also stickier than regular LDL.
So that's what blocks up the arteries.
It eventually it builds up like plaque on the arteries. So it narrows the patency of the vessel, leading to increase the work of the heart. So it increases the risk of cardiovascular disease. But with time, like I said, in chlorinated water, you see an increased incidence of bowel cancer as well as bladder cancer. Because the chlorine is also a potent inflammatory agent, and inflammation is associated with things.
Interesting. Because they used to associate eggs, eating too much eggs, raise your cholesterol levels. But there's also a new research that debunked that.
Well, the thing is, it is a bit of an oversimplification to talk about a specific food. Because some studies will tell you up to 90% of the cholesterol in your body is produced by your body itself. Yeah? So if the body is producing 90% and you get only about 10% from your food, how likely is that to cause any serious harm to you? So foods we eat can produce or increase the amount of cholesterol we produce. One of the commonest things they do now is to use statins to bring down cholesterol, but statins are a poison. So we creating a problem where we could probably avoid avoiding the use of statins. We could probably avoid the problem that statins create. But talking about cancer and that, what we need to understand is that if a cancer presents, for example, in females, because I'm a obstetrician and gynecologist, so I talk a lot about females. In females, one of these cancers that can be treated with a high percentage of cure is endometrial cancer. Why? Because it presents early, abnormal uterine bleeding. Now, a patient in a menopause, for example, postmenopausal, presents with abnormal uterine bleeding. The first thing we have to try to do is assess the endometrium. After we take a history, of course, assess the endometrium. We do that with an ultrasound scan. If the thickness of the endometrium is more than 3 millimeters, then we need to do a biopsy. Get some tissue to find out what is the underlying problem. So because of the early presentation, because when a patient is bleeding abnormally, like 51 is the average age of menopause in this country. So she's 54, 55, and she starts having the abnormal bleeding. Why is that so? So you are pushed in the direction of investigating.
Right.
So your chances are you pick it up early. So when you pick it up, if it's still confined to the uterus, a hysterectomy will cure. You see? So the earlier she presents, the more options we have. You know? And seeing that in that case, the in endometrial cancer, the cancer is still confined if she's present early enough to the uterus, just by removal of the uterus. Remember, I said one of the treatments for cancer we have is surgery. Removal of the uterus, surgical procedure, we call a hysterectomy.
What started cancer?
Cancer has a long, long history. Essentially, we can point a finger and say, well, that sad cancer or this cause cancer. There are a number of factors that can cause cancer. All right? Like we said, even the air we breathe from smoking, the dust can lead to increased risk of lung cancer. You know, women going through the change or through the menopause, they ask for HRT. If they use estrogen only, if the uterus is still inside, that increases the risk of endometrial cancer.
HRT.
HRT, the combined HRT, the ERT, estrogen only replacement therapy. So
what is HRT?
HRT is a combined form. We normally use it. ERT is a type of HRT. But to make the distinction, with HRT, you talk about estrogen and progesterone combined. When you talk about ERT, it's estrogen only.
So ERT can lead to cancer?
Yeah, in women with a uterus still in place. So when a woman still has a uterus, we offer them a combined preparation, estrogen and progesterone. Now, progesterone has been given a bad name because it has an increased association with breast cancer. All right? But there's a newer type of progesterone we call micronized progesterone or uterostan, which has, it doesn't have a reduce, but it does increase the risk of breast cancer. Yeah.
I want to get more understanding about HRT because when women are going through menopause, they put them on HRT.
Yeah.
But you said
ERT
is what led to the cancer.
Can lead to cancer if they have the uterus still inside.
If they have the uterus.
Okay.
So how HRT plays a role in cancer?
Well, the thing is, if a woman wants HRT, hormone replacement therapy,
right,
but she has a uterus inside, the advice is to use combined preparation. So the estrogen is given. Yes, the estrogen will cause the endometrium to be thickened, but the progesterone, that's the other part of the combined hormone replacement therapy, will tamper the effect of the estrogen.
But is that a protocol? Because it's not.
Yes,
it's not every female got that information. Because some women just said you need to go on HRT without no form of information.
No,
like
well,
what you're needing
before we start HRT, a standard practice would say, hey, do you still have the uterus inside? Yes. Okay. The type would recommend it's a combined preparation, which is estrogen plus progesterone.
So it's important for female to know this.
To know that, yeah. And most doctors would tell the patient that up front,
Okay.
And
but I know someone that's been put on HRT and the doctor hasn't told them about that.
Well,
that's why I asked.
That is sad. That is sad. And those things happen.
It does.
Yeah, but
it does.
Probably it's happening too often because if one patient, for example, is placed on ERT and she has a uterus inside and they have not been counseled about the necessary protective effect of the progesterone, then it's not good. But having said that, when you combine progesterone with the estrogen, you also have side effects from the progesterone. Yeah, you have breast tenderness, pain in the breast. You have an increased incidence of breast cancer.
Right.
It also has a negative effect on your mentation. It increases the risk of depression and stuff like that. So, it's necessary to counsel the patient appropriately. And some people may say, well, hey, if you need the progesterone just to counteract the effect of the estrogen on the uterus, why not just take off the uterus? The argument against that is that it's removing the uterus is very involved surgery.
Right.
With a lot of the things can go wrong surgically. And the risk of going under anesthesia and stuff like that. So You try to minimize. It's like an ethical thing, risk-benefit analysis.
When people hear about feeding cancer, what do they misunderstand?
I'll just back up by answering that. You'd realize people with cancer, especially in the advanced stage, will seem weaker, get tired easier, and doesn't seem to have any energy. And you may wonder, well, why is that so? You're okay, then you have this disease, and suddenly you can't do this, you can't do that, thing you need to understand is that one cancer cell uses 200 times the amount of glucose, and glucose is the energy currency of the cell.
Right.
200 times the amount of glucose than a regular normal cell. So you have a normal cell here and a cancerous cell here. This normal cell, maybe use 1 glucose as a unit of energy. This cancerous cell uses 200 times that. So all your energy supply is being drawn by the cancerous cell. Hence the increased fatigability seen in the patient with cancer, the lack of energy, and the eventual weight loss, because after that, when you're not getting enough energy, the body must break down whatever it has, it stores, to provide energy for the cancer cell.
But don't everything that we eat turns into glucose?
Not everything, but a lot of what we eat.
So if a cancer patient, they're going through cancer, what would they need to be eating to not feed this cancer?
Well, the thing is, it's not so much a question of what they need to be, because the cancer, let's just tell that, the cancer has a way of protecting itself. It's looking after itself, so to speak. So in addition to drawing 200 times the amount of glucose that a normal cell does, it also develops its own blood supply, vascularization. So anything that gets the blood, the cancer will get its fair share. Another thing is, where you might say, well, hey, if we keep the cancer short, if we starve it from oxygen, then the cancer will die. That's not true. The cancer can live both in an oxygenated environment as well as a deoxygenated environment. Okay? So most of what you eat, once the glucose is formed from it, the cancer will get its supply because it has a way of sort of ensuring that it doesn't starve to death.
So I often hear about starving the cancer. And what you're explaining to me now, it seems a bit difficult.
It's difficult, but it's impossible to starve the cancer. Because just look around you, anybody who's suffering from cancer, the weight loss is a prominent feature.
So can diet really help with cancer, really?
Can what? Diet. It is difficult to see a particular diet that helps with a patient suffering from cancer, right? What it can do is slow down, if at all, but then that's a difficult call, because whether you say, well, hey, for example, red meat is strongly associated with bowel cancer, all right?
How?
Well, red meat has some nitrogen compounds, nitrosamines that are pro-cancer.
Interesting.
So if you eat, for example, in Argentina, where they were among the top 5% of the world red meat eaters, beef is one of the main components of the diet. And you find that they had one of the highest incidence of bowel cancers. Now you compare that group with a group from Okinawa, Japan, where they eat a lot of fungi. The brown fungus, is one of the staples in the diet. You find that the incidence of bowel cancer there in the far eastern countries is minimal compared to the Western world. Yeah, and it's basically the diet.
So is that's classified the blue zone?
Blue zone?
Yeah. Japan.
Japan, yeah.
Is it listed in the blue zone?
Yeah, okay, yeah.
I'm asking.
Well, the zoning thing, blue zone and so on, we just have to look more closely at what is specific to a particular region.
Okay.
Okay, so instead of trying to confuse yourself about blue zone, red zone, No. What is the underlying? What's different between the Western diet and the Eastern diet? You know, and in Okinawa, Japan, they have one of the lowest incidence of bowel cancers, one of the lowest incidence of heart disease, and so on. So when you say, well, why is that so? You look back at their diet and you see like there's something we call fusidan, which is one of the major components, the active agent in brown algae, and that is what is called. It is believed to be the reason why the incidence of cancer is so low.
Okay. If you could name a few food that concern you most, what would those food be?
Concerns in terms of trying to protect you against cancer?
Yeah.
Well, the commonest one, and probably the best one, is soursop. Soursop, believe it or not. Every aspect of that plant, leaves, the seeds, the bark, the fruit, the roots, are known to have some anti-cancer fighting ability. So they are very good. In fact, I think in that book I talk a lot about the soursop, because it is known, it has about 5 different avenues by which it attacks cancer. So if somebody was to come to me and say, hey, is there anything I can use to say reduce my risk? I would suggest the soursop. Yeah.
Any other foods?
Well, if you could get your hands on the fungus we're talking about that they use in Okinawa, then yes, those kind of things.
Fungus?
Yeah, they found the brown fungus, slimy brown fungus, we call it. The active agent, like I said, is fusidan, which helps to fight against cancer.
Omega-3.
Omega-3 is the powerful agent which is helpful to reduce the risk of inflammation. Right? It is known to have protective effects for the cardiovascular system, and is generally considered to be a healthy component of one's diet. So it should be encouraged because of its beneficial effects.
Do you take supplement, Doc?
I do from time to time, but it's a kind of helter-skelter approach.
What do you mean?
Like for example, I will not regularly take something like I'm on this regularly, but from time to time I take some things. Yeah.
So, like as a doctor, sometimes you take supplement. Like, what supplement do you take?
Well, sometimes I use some zinc. I use some magnesium. The magnesium kind of relaxes you and helps you to sleep very well.
Okay.
So if, for example, you have had a hard day and so on, and you're lying down, but you're just tossing up and down, you're not going off to sleep. Magnesium.
And that can calm you down after one dose?
Yeah.
Okay.
If you try it tonight, you'll see the difference.
To be honest with you, I take magnesium every single day. I don't know why, but I take it every single day.
Yeah.
So I'm wondering if I'm overdoing it.
What I would suggest before you go on any regime which requires supplements, you speak to your GP and get the necessary investigations done. Because you don't want, for example, to be on a particular medication and then you take the supplement innocently and it's affecting the result of the other medication. So the general advice is you're thinking or you're read somewhere, you see somebody tell you, well, hey, why not try this? Why not try that? You go into your GP and say, hey, doc, I know I'm on ABC, but I'm learning that maybe X would be beneficial to my situation. So and have that discussion and then let him, because you'd have your medical records with him.
Right.
So you'd be able to review and see, well, what is appropriate, what is not appropriate. How could this drug affect this medication? Stuff like that. So he'd be able to give you appropriate advice.
Does fasting genuinely help the risk of cancer?
Help?
Yeah.
It's supposed to be protective. Fasting?
Yeah.
Yeah. It is believed to be useful in terms of helping your overall health. So if you have cancer, of course, the thing is, the cancer is going to get whatever it wants.
Right.
Because like I say, it develops own blood supply. It can work both in oxygen and without oxygen, and cancer cell doesn't die.
It doesn't
It
die.
doesn't die easily, no? Even when it cuts off the blood supply, or it cuts off the oxygen, it continues.
Well, I often heard, this is why sometimes it's good to have the knowledge, because I've seen lots of people on social media, doctor professionals, scientists, they're claiming that when you fast, your body, depending on how long you fast, your body go into a thing called autophagy, and that cuts off the cancer cell.
Well, it serves the cancer cell from glucose, from a source of glucose.
Okay.
But it will still get its source.
It will still get its source.
Yeah, it will still get it, but this, the blood supply, is blood bring the nutrients in the blood to the cancer, So if the cancer has its own blood supply, whatever nutrients get in your normal blood system, the cancer will get its supply.
So what would you say about people who actually, beat cancer and they didn't take any chemo, they didn't take any radiation, but they simply change their lifestyle, eating a certain diet and doing fasting? What would you say about that?
Well, it's important to determine whether or not they had cancer and the stage of the cancer. If the cancer has already taken over the body, they're not going to beat it.
So recently I've interviewed someone that the doctor gave her 3 months to live. And her oncologist put her on a particular diet. And she is now 13 years free of cancer, never took chemo, never done radiation, just diet, lifestyle changes.
What are the lifestyle changes we had? Just the diet?
So she eat more alkalized food, and she do vigorous exercises. And one of the things that the doctor recommended to her was to get the morning sunlight from about 10 to 2 thereabout, and she do that on a regular. And she eat most like plant-based, I would say. And she done that, and I think within 2 years or stuff, she was declared free.
How far advanced was the cancer though?
She was at stage 3.
Stage 3.
They gave her 3 months to live.
Okay. But how many success stories like that you have heard about?
Well,
Rare,
I don't know. It's really rare. So I'm asking you as a doctor,
Well, the thing is, individuals will tell different stories. Some of them may have been misinformed. Some of them may have accurate information. Sometimes, for some inexplicable reason, because if we knew, for example, definitely that patient has cancer A, and we put her on diet XYZ, and she's cured, everybody would be putting that patient on XYZ, And the other day, about maybe 2 years ago, there was this young lady from the church who was told she had breast cancer. She decided she's not going to have anything for the breast cancer. She's going to pray. All right? So she, of course, started to pray and so on. 2 years in, they contacted me and told me, hey, this young lady wants to have a chat with you. So I made myself available, had a chat with her. At the time, she was short of breath. She was already sick, that she was losing weight. And
with advance.
Yeah, and when I spoke to her, she could hardly keep conversation. She was short of breath. So I said, hey, when last you saw your GP? Oh, I'm not going back to them, because they want me to have surgery. But by then, surgery would be too late.
Right.
Because like I said earlier, surgery is for focal diseases that are here. So you just take off this organ that is affected, and you're with a cure. If it has gone beyond that organ, you may have to use chemotherapy. More than like if it's spread widely, you have to use chemotherapy. All right? So this patient said she didn't want chemotherapy, she didn't want radiation. So, and she was struggling, really struggling. So at that point, there's not much you can do. You couldn't say to her, go and eat ABC, you'll get better. There was another chap.
So did she pass?
She passed within 2 months after. Yeah, there was another chap from the Caribbean whom I had suggested to him. He was diagnosed having cancer, and it was a blood cancer he had. And I suggested to him to try to incorporate some soursop into his diet. He did that, and he went clear, no symptoms for about 6 months. But he was using the soursop regularly or daily.
Was he taking chemo?
No. Daily, he was doing something just cleared. Then he stopped because he felt so well. He didn't think he needed to continue doing that. Stopped, and within 3 months, he was back, and he has passed. And he was a young man in his 40s. So
chemotherapy, in your understanding, your experience, what is actually chemotherapy? Because I'm sure I came across something that chemotherapy is carcinogenic.
It can be a carcinogen. Actually, in my days in chemistry, one of the things I was trying to do is to convert, there's a drug we call DTIC, which we use for gynae cancers. Dialkyl imidazole, right? That's what we use for some type of gynae cancers. What I was trying to do in my lab was to try to convert it into a less toxic form, because that preparation leads to hair loss and stuff like that, vomiting, and so we're trying to make it to be less toxic by taking the nitrogen from the atom and putting in a sulfur. Okay, when we put in the sulfur, it didn't seem to work as well as the TTI, so we fell back. Yeah, so basically, what chemotherapy is a poison. It actually works by killing. It's supposed to work by killing cancer cells, but by killing cancer cells, it also kill normal cells.
You said it's a poison.
It is a poison. It's poisonous.
I know it's a poison, but why is it that we use it again?
Well, the thing is, when the cancer is spread, what option you have? You haven't got any options. Because
so is it that they're giving chemo, hoping it work?
Well, that's what the hope is. You know, it's like a risk-benefit analysis. You think, well, if I put this patient on chemotherapy and the cancer is sensitive to that particular chemotherapy agent, then I may gain some success. You may see some patients say, oh, I am free of cancer. I am in remission. But then 3-4 months later, a year later, symptoms recur.
So it's roll and rush it then?
I wouldn't quite call it that, I wouldn't quite call it that. But, it's done with a lot of hope. Right. And you have to bear in mind that with cancer, when you give them chemotherapy, they destroy healthy as well as non-healthy cells.
Definitely.
So it increases toxins, and you have to bear in mind that the number of dead cells you'll have after chemo, right? It increases the amount of toxins which your kidneys are exposed.
Right.
So your kidneys have to work a lot harder.
Oh, okay.
So one of the potential complications is kidney failure.
Yeah, I've seen that.
Yeah. So that's why it's like a risk-benefit analysis. And almost across the board, chemo hardly ever works. A person put on chemo hardly ever survives. Some may survive. And nowadays we have a different approach to chemo. We use some biological agents where we try to treat patients with medications which have been placed into bacteria we call capsids. And those work to try to destroy the cancer.
Do you see a better future for the hope of cancer patients?
The thing is, we have failed, and we continue to fail our approach to cancer. I would like to say is wrong. Yeah, because we have been doing that for years. What's happening now is you find increased specialization, where you have special units, cancer units. You have individuals with increased surgical skills. You have a range of other drugs, and everybody who comes on the market with a drug, they tend to promote it to the point where you think it's the best thing since sliced bread. It doesn't always happen that way. Like, for example, Herceptin, which was used recently, well, not recently, about 3 years ago, for breast cancer patients, it's only known to be effective in about 30% of the cases.
30%?
About 30%, and it's expensive. So again, you look at the ethics of it. If it's so expensive, obviously, third world countries cannot afford it. So if the first world countries can afford it, what makes their life better than the life of a third world person? Yeah? The expense is what separates them. I'm in the first world. I am able to get my government sponsors my treatment, so I'm able to get exposure to Herceptin, although it's only 30% effective. You in the third world, because it's so expensive, you cannot afford it, so you die with cancer. Not that Herceptin will make much of a difference, but it's just the question of justice and the ethics involved here.
It's like We are living in a doom world.
Well, it's not getting better, you know. It's not getting better because our focus probably is wrongly directed. You see, I think the Italians have a reasonably decent approach in the sense that they're looking now at how they can attack cancer cells specifically. But like I said earlier, the earlier we pick up cancer, the more options we have in terms of its treatment and the better the results. Okay? There is a substance that they're able to identify in the US called anti-cancer antibodies, right? Which is able to pick up any cancer even very, very early.
Yeah, I've seen that.
Yeah?
I've
And
seen that.
that allows individuals to present for treatment earlier. The downside of that test, though, is that you don't know where the cancer is. It just tells you you're exposed to cancer, you have been exposed to cancer, hence you can find those antibodies.
I've seen where the university, can't remember the university, where they create that same thing pattern where you can find the cancer early. It's called lung vaccine patient that have exposed to lung cancer. I'm not sure, but it wasn't launched as yet, but it was an experiment that they were conducting.
Well, it's still reasonably
Cambridge.
early. Still reasonably early. But in the US, they can pick it up for you. And once you have the antibodies, they know you have been exposed to cancer. So then you could start treatment. But where are you treating? Again, it comes down to chemotherapy.
Right.
You're going to beat poison, you're killing off a whole heap of cells. And you still don't know where the cancer is.
That's a bit tricky.
It is. It is. It is. It is.
In your book, Stop.
You read the book? Oh, the other book.
Stop. In your book, Stop. It's not too late. Very interesting book.
Thank you.
I would encourage people to get that book.
Okay.
And you wrote several other books, which we will get into.
Yeah.
And that is one of them.
Right.
You talk about transitioning to plant-based. Tell us about that journey.
Well, generally, it is felt that a plant diet is considered healthier. Because when you take a bit of meat, for example, in fact, if you were at my last talk on microplastic and heart disease,
yeah, I was.
You were there.
Yeah.
Okay. You see how the microplastics affected your body.
Right.
You see how the chlorine in the water affected your body. All right? Now, if you have a situation where in that presentation, there was a picture I showed, a slide, where there was a fish with its mouth full of plastics, you know? Now, if you are on a plant-based diet, you avoid those things to a great degree.
True.
Yeah? And like I said earlier, red meat is not good for your bowels, right? There's an increase in bowel cancer with red meat. But plant-based diet, that's not the case. Additionally, plants allow you to remain fuller, longer. They help the ease at which you pass your feces.
Because you also explain into the book as well where plant-based, vegan, vegetarian, and carnivore.
Carnivore side.
Right. The risk between all three, there are lower risk when plant-based and vegan compared to people that...
Yeah, which I just said, yeah.
Right. So it pays then to basically, because I'm not vegan, I'm not vegetarian, I'm not carnivore. I would say I'm a mixitarian.
Omnivore.
Yeah. I eat.
Yeah.
But what I do is, since my mom passed, is eliminate meat as much as I can.
Red meat is, meat, period, but red meat specifically.
Right. So I mainly eat chicken. I love my oxtail. I don't know if I will ever cut out oxtail. I love my oxtail.
Well, it's the same here.
I love my oxtail. Yeah, I love my oxtail. So, but beef, those stuff, I don't really trouble them. From Monday to Saturday, plant-based. Sunday, I will have a bit of a meat.
You gotta go cheating on Sunday.
Sunday is my cheat date. So again, we go back into Japan,
Uh-huh.
where their diet is predominantly
Plant-based.
plant-based.
Yeah.
So it does pay to eat.
Yeah, but any plant you see in the Japan environment, the active agent of the food they eat, the main one of the main staples is fucoidan, which is fucoidan, the brown seaweed component that is very useful. In fact, fucoidan by itself has a lot of anti-cancer.
This is actual seaweed.
Yeah, seaweed. Yeah, let's talk about it in this book on cancer.
It's interesting because
Not ordinary seaweed that we have in the Caribbean on the store.
No. Because seaweed was introduced to me some time ago. Was crispy. It tastes a little bit salty. Obviously, been through a little bit of process.
They have a process type of seaweed they use. I'm not sure about the body of that.
Right.
Yeah. So the one they use in Japan is slimy, man. It's very it's brown seaweed they call it. And the active agent, like I said, is fucoidan. No?
Macronutrient.
Macronutrients.
When I was going to the gym, I used to hear about macronutrients a lot. But I still cannot understand it, right? But why do macronutrient matters more to people than anything else?
They're more filling. You talk about the carbohydrates, macro. You talk about the fats, macro. You talk about the proteins. For the same reason you eat the meat.
So it's a combination.
Well, all those factors are filling. So if, for example, you feel peckish now and you go eat a banana, eat an orange or so, it picks you up a little bit. But if you want to remain satiated for some time, you eat a piece of dashing, a piece of yam, a piece of, some rice and so on. It keeps you filled for a longer time. Yeah? And those are necessary components of your diet,
Fruits and vegetables. Is there a particular time to eat fruit or vegetable? Because in your book you talk about night and...
Yeah, well, what you find, what the research is telling us is when you eat fruits the first thing in the morning, it's most useful to you. All right? So that's something that individuals will gravitate to. In fact, we're growing up as a little boy in the Caribbean. We always ate our fruits in the morning. We never questioned it. We always ate our fruits in the morning. It's now we begin to realize, there was some reason for that, Yeah.
If someone listening today and want to reduce cancer risk without extreme, where should they start?
By lifestyle changes.
Lifestyle changes.
And we talk about lifestyle, we talk mainly about diet, whatever they put into their bodies. We talk about the use of water, the use of a good night's sleep, and physical activity. Yeah? With sleep, for example, if you're not sleeping well, your stress levels go up.
Right.
When your stress levels go up, your stress juices flood your system.
Right.
And it has a lot of debilitating effects on you. Your productivity decreases, your burnout levels increase, and your focus is all over the shop. Poor focus. So that in itself affects your mood.
Because your body repairs during the night as well.
Well, yeah, that's when the most of the repair takes place in the night.
Okay.
Yeah. So with a good night's sleep, but if your night's sleep has been broken up, it affects the amount of repair that's been done. In fact, even in brain cells, the amount of blood circulating through your brain, the spaces between the sinuses in the brain actually widen during deep sleep to allow more of the cerebrospinal fluid to circulate through the brain, so you can take away more toxins from the brain.
You write several books.
Yeah.
Including the one that I got from you. I know I'm getting this one. What encouraged you to write these books?
Again, we're going into a long story now. You see, like I told you when we started, my professional career started as a teacher. Then I went into chemistry, and not something too full of myself, but when I got into chemistry, the intention was to cure cancer. All right, that was my intention.
Why?
I had a sister who passed at 38 with breast cancer. I was in medical school at the time when they called me and told me that I never knew she was sick. She was in the States. I never knew she was sick. Yes, I had spent the year before with her. I never knew she was sick, and then got a call in the morning, 7:30 in the morning, preparing to go to school. I said, do you know? That's her name was Annie. Annie is dead. I said, what? I said, yes. I said, what happened? Oh, we're not sure, but I think she may have had cancer of the breast. She never told anybody about it. I think probably the only person she told was her husband. And I think my mother got to know at some point, but we never knew, you know? So again, late presentation. So by the time we knew, she was struggling to breathe. Her lungs were full of water. Yeah, heart failure and so on. And my sister in the States also told us when she went to see her, there were a amount of tubes coming from her. And by then she had already had a mastectomy, what you call a toilet mastectomy, just to take it
So you never knew all of that?
We never knew. We never knew. In fact, it's after my sister in the States spoke to the doctor as to what's going on. You know, he didn't want to talk to her. He said, well, I'm the only sister in the States here, so, you know. And then they eventually told her that she had a mastectomy done. What we call a toilet mastectomy. It wasn't going to cure it because the cancer had already spread outside of the breast. So what you would need was chemotherapy. But like we said, chemotherapy is already a toxin, a poison. So the cancer load plus the toxins would not do well for her kidneys. So even that impacts on the type of drugs we can use because the drugs may affect the kidneys also.
And that led you to?
Well, I had actually been, well, the thing is maybe I would call myself a troublesome fellow. I'm inquisitive. I like to do things that are different, you know? And I was told that since I was growing up, I was always being told cancer is not curable. Cancer is this, cancer is that. People get cancer, they die. That's basically what I was taught. So I said, hey, there must be a way around it. So I gave myself the challenge, find a cure for this, you know? So I got into chemistry, dabbled around with chemistry and so on. But look at where we are now, you know? So it is difficult. Cancer will continue to proliferate because of the number of different factors that lead to cancer. Some of our medications we use are carcinogens. Right? The water, like we spoke about earlier, chlorine in the water, the food we eat, red meat, you know, the fact that we tend to be very sedentary, you know, TV, iPhones, people are not socializing no more. People tend to be at a home on a couch or on a table, stuff like that, you know? So those kind of factors have invaded our lifestyle and we are suffering.
The Amish community, they find less rate of cancer, they find less
I don't know much
rate.
about them though.
You don't know much about them?
No.
Okay. Well, I've looked into them a lot because their lifestyle really interests me. So I looked into them a lot. They find less rate in even autism.
They move around a lot, don't they?
Yeah.
And they eat
They don't have TVs. They don't use cell phone like that. They don't use microwave. Preserve food, they use natural way of preserving their foods. They don't use food from cans. They use food from the gardens. Processed food is not something in their regime.
It's not very healthy, you know. It has lots of sugar, lots of salt in there.
So it's very interesting that the risk of cancer, ADHD, and other illnesses is very minimal in that community.
Well, yeah.
Where the lifestyle is really...
Well, if they're not... One of the things we should understand is also the blue light that we see from our computers or TVs and so on. Those are not necessarily the healthiest type of light to be exposed to.
Right.
In fact, they can interrupt your sleep. They can affect your ability to sleep, you know? So, and also recently, there has been an association between telephone usage and brain cancers, you know? So, you know, our lifestyle, what we take as necessary tools for our comfort may be hurting us.
That really interests me, you know. But we probably won't get into it because of time.
Yeah.
But I've interviewed someone recently, and they said something about convenience and food, but it's actually hurting us.
Yeah.
How like I was watching a diagram of the food industry a few weeks ago when they talk about the plantation versus the food industries.
Yeah.
And how from in the 80s coming up, how the plantation shrink and the industries go forward because people are going more off a convenience rather than spending the time. And it's the same with when it helps. Yeah, I've questioned myself sometime. Why is it that stuff that is so healthy for you is so expensive, but stuff that is unhealthy for you is so cheap?
Right.
The industry is making it easier for you to basically get yourself sick.
Well, yeah, well, there's no value to keeping you well, you know.
No, it's not.
It's getting you sick, you have to depend on them for the medication and stuff like that.
It's so interesting how the pharmaceutical business come into play, but
Yeah.
that's not a topic we'll get into right now. But I really want to thank you for taking the time out.
Well, thank you. Thank you.
I've learned a lot.
Thank you.
But we have a closing tradition where the guests leave an encouraging word for the next guest that coming up.
Okay.
And the guest that leave an encouraging word for you goes by the name of Phill Watts. And he had colon cancer. And he said, be strong and courageous. Do not be afraid. You should be familiar with this scripture. Be strong and courageous. Do not be afraid. Do not be discouraged. For the Lord God will be with you wherever you go. And that's taken from Joshua 1, verse 8 to 9. I'm going to ask you to basically leave your encouraging word for my next listener, my next visitor. Thank you again, Dr. Harris, for sharing this information to us. And I wish you all the best in your career.
Thank you.
And keep doing up the good work.
Thank you.
To my regular listeners, thank you for joining us. If any part of this conversation interests you, let me know in the comment section. Until next time, stay safe, stay blessed, and eat healthy.
Okay.